something that's maybe pocket change for them. I don't know what to do about that, but I do have that concern. The other one that I have relates to the issue of youth decoys, which is in section, where are we? 6.20.010, definitions, number F. And it's one part of this, and it's the part that says reasonably appears under the age of 18. I think that could be a challenge, could be an issue, because I think that determining whether or not someone reasonably appears to be under the age of 18 is pretty subjective these days. I think about the analogy about some of the laws around sexual contact between minors and adults. And if you're a 25-year-old man and you are arrested on suspicion of having sex with a 14-year-old, I don't think you have a really good, strong defense saying, well, I thought she looked like she was 18. So that's my concern. And I think the retailers who seem to be handling this issue, what I've seen in stores is that they just say, well, we card everybody who looks under 30, and therefore they're really covering themselves. And so I don't see any reason why that phrase even needs to be in the definition.
Okay. Any additional, Doctor?
That's it.
Okay. Thank you very much. Next speaker is Susan Keegan, please.
Good morning, board members. My name is Susan Keegan. I'm a volunteer legislative advocate for the American Cancer Society, and I've been involved with this ordinance for quite some time. I want to start by thanking this board for making such a difference in the health of the county. Since this ordinance was enacted in December of 2004, the sales rates to minors in this county has dropped by 50%. Since 1 out of 3 minors who begin smoking will ultimately die of a smoking-related ailment, you've already saved the lives of lots and lots of children. That said, while I generally am supportive of this ordinance, and I think there are a lot of good things about it, I do have some concerns. The first one I have is for whoever is the designee of Health and Human Services, who has the discretion to meet with merchants to determine what their penalty should be. Frankly, I think that puts an awful lot of pressure on a person who's often a political appointee and serves at the pleasure of the board. Especially when you see that merchants come to the board and they're angry about being required to follow a law that's been on the books of this country for over 100 years. It's been against the law to sell to minors for 100 years, but we're still here talking about whether it's fair the way that we do it. So I feel bad for whoever's going to have to meet with merchants and have all of that discretion in their hands, because I know how very difficult that will be. The second thing is, I just want to reply to Mr. Gravier, who said that he shouldn't be really held responsible for the act of an employee. But that's simply the way that we do it in this country. All employers are held responsible for the acts of their employees. They're responsible for training them. You can ask anybody from the hospital. They have minimum wage employees that they train, and if they find those employees in violation, the hospital is held accountable. Finally, I do want to speak up for the small merchants. I'm not known as a friend to merchants, especially those who sell to minors. However, I think that this is incredibly inequitable. The nice thing about suspensions was it was proportionate to the business that you did in tobacco. Now what we see is somebody who's got a little mom and pop grocery store is going to face the same level of fines as Walmart and Safeway. And yes, Walmart and Safeway do sell tobacco to minors on occasion. And they're going to look at $5,000 and say that's a drop in the bucket. It's not going to mean anything to them. Somebody else, $5,000 is going to be a big hit. And I think that we owe it to the small merchants in this county to be fair to everyone. Thank you.
Thank you, Ms. Keegan.
Any questions?
Supervisor Smith?
No, I'll wait till the end.
Okay. Thank you. Next speaker is John McCowan.
Thank you, Mr. Chair, members of the board.
I think that most of the changes are reasonable. They provide more flexibility than the original ordinance. I would like to second the comments of the last speaker that the penalty should be proportionate to the amount of business that a person does. So, I think you could have a graduated fine system based on the total retail sales of tobacco products. And that way, people would be paying a penalty in relation to the amount of business they did rather than the small retailers suffering the same penalty. I also support that the current fine schedule allows flexibility so that those retailers that are trying to comply in good faith and have training programs and have the other measures in place aren't penalized severely. And that should probably be explicitly spelled out in the ordinance that that's the intention, that if they can demonstrate that they're making a good faith effort to comply, they should be at the minimum fine level. I also support the concern of Dr. Wandry that the language on youth decoys seems to create a defense for people who do actually sell to a minor. It's pretty restrictive to say the youth decoy must reasonably appear to be under the age of 18.